Take a step to the right and a step to the left. Doesn't really matter in the end, cause good things follow. They follow me. Good things follow. They follow me.
Hello, my name is Lieutenant Brian Washington, and I am the Drug Demand Reduction Outreach Civil Operator and Program Manager with the Maryland Counter Drug Program. I am honored to announce our next set of panelists for the session, A Communications Toolkit for Preventing Substance Use in Youth. Each of these panelists serve on the HIDA Prevention Communications Advisory Council and hold extensive expertise in the areas of substance use prevention and communication science. Together, they will introduce the core communication strategies provided in the Youth Prevention Communications Toolkit. Our panelists include Sean Adamick, Alexandra Plant, Clara Gibbons, and Robert Lachelle. Sean Adamick is founder and president of Adamick Communications, a strategic communications consulting practice specializing in strategy, messaging, and reputation for mission-driven organizations. Adamick has directed the strategic communications efforts of major international nonprofit and philanthropic organizations, government offices, and political and advocacy campaigns. Alexandra Plant is a director at the National Council for Mental Well-Being, specializing in substance use disorder initiatives, and works alongside the United Nations Office of Drug Control and Crime on unethical practices in substance use disorder treatment and recovery. Previously, she has served as a consultant to the U.S. federal agencies and state policymakers, international agencies, and private entities. Clara Gibbons serves as a principal strategist in the Research Interpretation and Application Unit at the Frameworks Institute, where she currently supports substance use prevention communication projects. Her previous works include research on restorative justice programs for youth, as well as indigent defense delivery system. Dr. Robert Lachelle is a professor in the Department of Public Health Services at California Baptist University and board member of the National Prevention Science Coalition to Improve Lives. He is a nationally recognized leader in the areas of substance use prevention, program evaluation, and prevention science. His research interests are in the areas of alcohol, tobacco and drug prevention, teen pregnancy prevention, obesity prevention, and parent-child relationships. We are immensely grateful to have these individuals with us here today. On behalf of the Washington-Baltimore HIDA, ADAPT, and the Maryland Counter Drug Program, I would like to welcome our panelists. Dr. Papard, I now turn it over to you to kick off the session.
Thank you, Sergeant Washington. All right, are we ready to do this? We're going to dive into the toolkit. For those of you just joining us, the entire HIDA Prevention Summit has been based on bringing to you the best available evidence that we have currently related to communicating for substance use prevention. That includes preventing onset or escalation of substance use in youth aged 12 to 18. So what we'd like to do today is the ADAPT team, in collaboration with numerous other organizations and people, we've developed a toolkit for you guys. And you know what? The reason that we have developed this is really it's selfish in nature. We've been needing to respond to multiple technical assistance requests coming in on this topic from our HIDA communities. So what we'd like to do is talk you through our approach. This is what we've done in order to prepare the toolkit. If we could go back one. Our approach to this has been an extensive literature review. So we have a systematic approach that we apply to developing any product or offering any service. It always begins with a review of the literature, and a lot of you rely on us for that, right? To help you make more informed decisions about either spending your funding or selecting programs that might make sense for your unique needs. After we conducted the extensive literature review, we then sought guidance from something we call a HIDA Prevention Communications Council. That council is comprised of members, which you will see on the next slide, but they have provided valuable and priceless input into shaping the direction of this toolkit. Then we convened a key stakeholder meeting of those who might actually be using it, right? Including public safety, healthcare providers, educators, caregivers, prevention professionals, coalitions. And what we did was initially introduce some of the frames that were bubbling out of this evidence and the social norms approach, how that's been integrated into those frames. After that key stakeholder meeting, then we had individual discussion groups that were conducted with those specific role representatives. So one discussion group for public safety, one for prevention professionals, one for educators, and so on. After the discussion groups took place, what we did was we took that information and we created something called playbooks that offered very unique special considerations, scenarios in which those specific roles could see themselves communicating with youth and using the strategies in the toolkit. Those playbooks are available, as you'll see in the toolkit. And we took then all of that information and we consulted with youth. So what do you think, right? I know this was studied with you and by you, right? And you were included in developing the frames themselves and maybe the preferred frames. But what do you think now that we've translated the social norms approach into some of the preferred frames that we have found in the evidence? And took that feedback and then created the toolkit, designed it with multiple layers of review by the HIDA Prevention Communications Council, and sent it out for external review by then again, another set of numerous experts, content experts, and also potential users. Then we conducted a final review, and that was just completed last week. And what you have available for you now is the final Substance Use Prevention Communications Toolkit for today. And I say that kind of jokingly because it seems like we're constantly making tweaks and updates. Like we just found an image that we'd like to include on the next version. So I'm going to call it a living document. And the link has been provided to that toolkit for you in the chat box, and it will be consistently updated. So I will always refer you to the link for the latest version of that toolkit. As evidence evolves, we will be updating the toolkit, and you can always find the updated version on our website. All right, so here's the HIDA Prevention Communications Council. I won't linger here. You're going to hear from a lot of these folks today as they present the science. The way the toolkit is, the infrastructure that we've built for this particular toolkit is like this. It's a lot of information, folks. It's a lot of information. We are providing a starting point for you in thinking through this and trying to identify the areas and the frames and examples that maybe resonate with you most and with your community and the work that you're doing. So we've divided the toolkit into two sections. You're going to have an introduction and orientation to the entire toolkit that you'll see. But then part one is going to focus on what we call dynamic communication. So how to think about and use the frames, general communications guidance that you might need for having dynamic conversations with youth, right? And that could be one-on-one, or that could be individually with a group, right? What I'm going to talk you through kind of the infrastructure of the different parts, because it's similar in part two, but it's enhanced. After we provide a quick start guide, because a lot of you said we want the bottom line up front, we want to get started quickly. So we've provided a quick start guide right in the beginning, nice summary. But then general communications guidance is there to set the stage for success in having those conversations. We provide the understanding of social norms that Wes and Michael just beautifully led us through. And then we provide the actual conversational frames with a description of them, with examples, so that you have an understanding of how it's been applied. Then we give you some suggestions of what to avoid based on the evidence, right? And beyond the messages, what happens next, right? After that conversation's been had or that group discussion has been had, what happens next? And then you'll find the role-specific playbooks I referred to earlier. In part two, the difference with this is mass communications guidance, and this is what we call static communication. So it's unidirectional. It's not going to be bidirectional like those dynamic conversations. And so you'll also find a quick start guide here. You'll find information on breaking down upstream prevention communications, how to prepare communities for prevention, because oftentimes you might find that you need to build readiness in that community to receive the actual communication that you'd like to implement. General communications guidance is there, and it's a little different, right, from mass communications with some underlying similar principles. We break down understanding social norms a little further for you in that section. Static frames are presented, meaning the unidirectional frames with specific examples just for that purpose, as well as frames to avoid. And something different that we've added to this section is if you are having to in some way build support in your community or with policymakers or with funders or whoever it may be within your organization, even if you just need to build support and change mindsets more towards leaning into substance use prevention for whatever reason, we've got frames for that. And so that also is found in part 2. We offer suggestions for how to think through beyond the message, which is a very short section. And then importantly, how you can, within a comprehensive prevention strategy, choose communication channels that might be more effective compared to others when you are developing your communication plan. So we have tables with the advantages and disadvantages of each channel. And very importantly, we discuss how to evaluate the impact of what you're doing within dynamic conversations. How do you know that it's working, that it's having an effect? And then how do you know that the campaign that you've just launched or any of those educational flyers or billboards or whatever channel you've chosen, how do you know that it's having an impact? So what you'll see here are just some examples of those different types of frames. I'm not going through them because our presenters will be doing that, but I want you to note up top, the first is for conversational. The next is for static. The next is for changing those mindsets. And then we finally have frames to avoid. So I'm going to conclude this introduction of our toolkit with our call to action. The time is now, folks. So what we would like to do is issue a call to action called Mind the Message. I started it this morning and we've kind of been hinting towards it all summit long, but the goal of the Mind the Message call to action is to integrate the best available evidence today into your communications with youth. And so we have 4 steps that we're proposing. Number 1 is to pledge, and you've got that link to pledge right here in your chat box. Number 2 is to learn one positive social norm, just one. Try it out. Learn one positive social norm for substance use in your community. And then once you've learned it, use it in some way. Use that positive norm in a frame when communicating with youth. And finally, share the call to action. Share it. Share it with others. Anyone who engages with youth, this could benefit them. You heard from Wes and Michael, message, message, message. The more that we can get that positive norm out, the actual true norm into the community, it balances things and can be protective in nature. So with that, what I'm going to do is moderate this panel, and we are going to start out just as the toolkit unfolds with the guidance behind general communications. Sean?
Thanks so much, Laura. Hi, everybody. Thanks for having me. Thanks for being here. I'm going to provide sort of an overview on smart communication strategies. It is many of which are specific to substance use prevention, but they're also interchangeable. And so as you develop communication strategies, both that static communication, right, putting out on blogs or websites or collateral material or any sort of one-way communication, or dynamic communication strategies in terms of conversing with young people. We're going to go through those. So the general rule of thumb is to know before you go. You hear a lot of the list that you see in front of you from people who do what I do, which is strategic communications consulting. I'm going to dive underneath that and tell you what we mean by each of these. Simply throwing everything you have at a communication strategy may feel really good, and I'll admit may even work, right? Not 1 time out of 10. But chances are you are going to waste a lot of time and money on strategies that not only miss the mark, but actually may drive audiences in the opposite direction. Let me say that again. You may, without being strategic, not only not be effective, but you actually may dig yourself a deeper hole. And that's what the research shows. Now that could be a pretty profound statement. A lot of my clients have this sort of palm to forehead moment, like, oh my God, I knew my stuff didn't work. I didn't know it was having the opposite effect. And so what we're going to try to do today is prevent that. And you may be asking, opposite of what, right? And that's where this first point comes in, identifying your goals. What do you want your communication to do, right? How should my audience behave as a result of it? This should be the first thing you ask yourself on anything you put out internally or externally. Who needs to act and in what ways? And is my communication aligned with that goal? What do I want it to do? And how should my audience behave as a result? Know your audience is, it's a common refrain among communications experts that is often misunderstood. Knowing your audience does not necessarily mean doing extensive research on your audience. It would be great if we all had the research to do extensive, if we all had the resources to do extensive research on our audiences. But really what I mean here is just taking a moment to understand not just audiences, right, who you want to hit with that communication, but actors, who needs to behave in certain ways in order to make it more likely you reach your goals. And so start with a brainstorm. Who needs to act to achieve the goal? That brainstorm could be pretty extensive. That's okay. Then for each of those audiences, how must they act? In what ways do they need to behave in order to make it more likely that we hit our goals? And then why would they act that way? And this speaks to motivations. I often use the example of my children, right? I want my kids to clean their rooms. They have certain motivations, natural inclinations of why they might do that. Makes me happier as their father, right? Makes for a more peaceful household. They can find their stuff easier. They can navigate their bedrooms easier, right? But then they've got some natural barriers to those behaviors as well. So why aren't they acting that way now? Well, in the case of my kids, they may not act that way because they got better things to do, more fun things to do. It's a pain in the butt to clean your room. They like it messy. All of those natural barriers to why they might not act in the way I desire them to act. And the reason this is important, let me just pause here. The reason that motivations and barriers are important is because the key to persuasive communications is not to convince people that they're wrong about their barriers. It's not to convince people that their barriers are inaccurate. It's to double down on their motivations and help them forget their barriers ever existed, right? And we do that by doubling down on their motivations. And so for those reasons, it's super important to identify what those are. What do we want them to do? Why would they do that? Why aren't they doing it now? And then we speak to their needs. What do they need to know, trust, or believe in order to make it more likely to act in the way we want them to act? So in the case of my kids cleaning their room, they need to know it will make me happy. They need to know there's some benefit to them. They need to know that after it's done, I'm going to stop hounding them to do chores, right? They need to trust that it's going to make for a more peaceful household. They need to believe that they're going to get something out of this action that they're not naturally inclined to do, right? And so what do they need to know, trust, or believe? And then who influences them? We'll talk for a minute. We'll talk in a minute about why that's important. And then where can we find them? Where do they naturally congregate? Where do they get their information and who do they trust to get it from? And this speaks to the be strategic. If you identify your goals and then you go through that protocol of audiences, suddenly you've got the blueprint for a communication strategy because it allows you for everything external to ask yourself these questions. Am I speaking to my audience's motivations? Am I mitigating or dismissing their barriers? Does my message give what they need to know, trust, or believe? In other words, am I meeting their needs, right? Does it appeal to, this is important, or at least not alienate one or more of their influencers, right? And the reason that's important is because these actor groups that you identify who need to behave in certain ways in order to be more likely to reach their goals may not be direct audiences to you. It may, in fact, be, given who our natural audiences are and who we naturally influence, that their influencers are your direct audience. And so you want to make sure you're not alienating them and, if possible, actually appealing to them. And then finally, is the communication method utilizing a channel where my audience naturally is? We all feel like we should be on Twitter. We all feel like we need an Instagram account. Well, why? Right? What is that a channel where our audience naturally congregates? Is it a communication platform that they trust, that influences them? And in my message through those platforms, am I doubling down on the motivation? Am I mitigating or dismissing their barriers? And am I meeting their needs? So that's being strategic. Next, do no harm. Does my message avoid strategies that do not work or could be harmful? Clara's going to talk in a bit about the research and others. We know a bit about what does not work and what could potentially be harmful. And so listen closely to that. And then is person first, non-stigmatizing language used? We're going to talk about that in a second. And then lastly, evaluate and adjust. You know, it can be, in times of high stress, our cognitive abilities actually go down a couple of degrees. And so it's important before you deploy a communication strategy to actually think about how you know it will work. The reason for that is because it's very easy to prematurely make that assumption, that when it feels like you're out there in the ether, you're out there with your external communication and you're not getting any feedback, that we need to adjust course. And that may be premature. And so that's why before you start, determine how you're going to know it works and don't adjust until you've actually made that evaluation and that determination. Okay, dynamic communications. Laura talked about this. This is those conversations either with a group or individual. Establish rapport, right? Start the conversation with, an exploration of topics that they care about, right? If they're topics that you're unfamiliar with, ask them to explain it to you. Hey, you were talking about X the other day. Tell me about that, right? That immediately establishes rapport. It doesn't have to have anything to do about substance use. It could be just what's interesting in their lives. A respectful and collaborative tone, right? It's a conversation, it's not a lecture. There are two people in it. Part of being respectful is acknowledging that and practicing that and understanding that it may not go by your script and that's your job as the allied adult to navigate the conversation given those dynamics. Respect also means respecting boundaries. If the young person or people you're speaking to may put up those barriers or indicate that there's a discomfort with what you're talking about, respect those barriers, and that will go a long way in your ability to talk about difficult things in the future. Acknowledge their experience and agency. You know, I spent a long time in politics. Many of you may know that party ID among young voters is at an all-time low, right? In other words, young voters describing themselves or even registering them into a major party, and there's a reason for that. And the research shows that the reason for that is agency. When young voters, young people become a part of a club and they feel as though the club is doing their bidding for them, they don't like that so much. They like feeling as though they have individual agency over the future of their own lives. And so acknowledging that is super important. And it could be literally saying, hey, you're the expert, right? You get to decide, you know, and that sort of conveys, it acknowledges an agency that they inherently have. Now, importantly, what I did not say is it gives them agency, because that is not yours to give. They have that agency already, right? Your job as an adult ally is to acknowledge it, is to say it out loud and to let them know you know it, not that it is some privilege that you are conveying onto them, okay? Have frequent small conversations, right? This takes the pressure off. It keeps it informal. Frankly, it gives them an out. If they have some discomfort, they want to step out, it allows them to do that. It helps to counter the barrage of sort of media and sources that they get substances from, that they get messages regarding substances from. And then time the conversation. Do it during everyday activities, meals, class prep. Avoid conversations when emotions are high or at times of great stress, right? Again, our cognitive abilities go down during those times. Active listening, this may be a concept you're familiar with. Body language, lean in, speak with your eyes, nod a lot. Open-ended questions. Tell me about. Describe for me. Affirmation. I appreciate you bringing this up. This is hard work you're doing. Just affirms what they're going through. Reflections. You want to hang out with your friends, and at the same time, you're concerned they'll pressure you into something, right? It's been hard. It's been a long week. You may be stressed about what's going on. And then summaries. This is, hey, just so I know I'm hearing you correctly. And then summarize what you heard. Static communications. Persuasive messaging strategies, all the things we just talked about earlier, right? Simple, relatable, empowering. The default to confusion is the status quo, right? If our audiences are confused, they will stay where they are. And the default to being talked down to is rebellion, particularly with 12 to 18-year-olds. And so we want to make sure we're not doing that. Positive framing, describe the benefits that come with choice not to use substances rather than the consequences of using them. Appeal to social interests. This is part of that establishing rapport that I talked about, and then emphasizing autonomy and choice. Hey, this is your life, your future. You get to decide. You know what's best. And then match the communications channel with your goals. Don't get on social media just because you feel like you need to. It's got to be strategically indicated.
Thank you, Sean. Thank you, Sean. Sorry, they've been warned. It's a panel, so we've got to get through the whole toolkit. But here's the neat thing. All of Sean's slides are there available for you in the resource supplement that is uploaded to this particular session. So Sean, again, I apologize for having to interrupt. We are now going to move on to Alexandra Plant. We'll come back to the whole panel at the end for Q&A, but Alexandra is going to introduce us to something really neat, guys. So the National Council actually published a Getting Candid guide a few months ago. Alexandra will tell us exactly when, but when we saw it here at ADAPT, we're like, this is great. This is great. And so we engaged them immediately to become part of the HIDA Prevention Communications Council. She's going to talk you through some of their work, which really is brought to life in our frames that you see in the toolkit. Alexandra?
Wonderful. Thank you so much, Laura, and welcome to everybody. Thank you for being here today and joining us. We will move ahead. But basically where I'm coming from and my background with the communications toolkit that we're talking about today is with the National Council and the Centers for Disease Control and Prevention, the CDC. The past 2 years, we've embarked on an initiative around framing the conversation around youth substance use prevention. And I think some of the big highlights of that are that we have done 4 large-scale youth needs assessments. Each one of those had over 600 youth respondents. And then we also did an adult healthcare provider survey needs assessment as well to really assess the impacts, attitudes, and preferences for substance use prevention messaging during the pandemic and post-pandemic. So we have really loved getting to work with the HIDA folks to kind of take some of our learnings with additional learnings from across the field to make something that is evidence-informed and practical and able to be applied. So this is just a quick overview of kind of the needs assessments that we did between last year, 2021 and 2022. And kind of where the Getting Candid project landed, and I am zooming out to feature a screenshot from it, is that, you know, there are certain stages that you go through when you're having a prevention conversation. And, you know, the first few steps are establishing trust and rapport, and also gathering insights to then frame the conversation and frame the communication, which is what I'm going to be talking about today for just a few minutes. Framing is the process of defining the context or issues surrounding something in a way that serves to influence how the context or the issues are perceived or evaluated. You know, so in this case, when talking about youth prevention, we're building on insights about an individual youth's values, their priorities, their interests, to frame and personalize the substance use prevention messaging in a way that is most likely to be perceived positively and evaluated as relevant to them and encourage behavioral change. So we'll go to the next slide. And really quick, as we just look at kind of the very small difference between the frames that Getting Candid which is the project I've been working on, highlights versus the HIDA Substance Use Prevention Communications Toolkit. The only one is that in Getting Candid, activities like hobbies, music, sports are pulled out, and the Framing the Conversation Toolkit really highlights social norms as we just heard about. And so I am going to breeze over the frame of social norms just because I know we just went into depth kind of around the science and the research around that intervention or framework. So the second one we're going to talk about, and Sean had mentioned this too previously, which is the importance of agency, autonomy, and self-affirmation. It refers to an individual's ability to make their own choices. And if we pull back and look at agency and autonomy, my mind went to motivational interviewing because that's a very prominent theory. And in motivational interviewing, you have three spirits that you use, three spirits of motivational interviewing, 3 out of 4, I should say, but it's evocation, partnership, and acceptance. And I think a lot of those overlap with this idea of agency, autonomy, and self-affirmation. So an example is you respect yourself and you want to make decisions that are best for you and your health. Maybe that's why so many of you are sticking by your choice to avoid drugs and alcohol. So the first one really, the first sentence there really focuses on the agency, self-affirmation, autonomy, and then the second sentence here is solidly social norms. So just doing a little combo there. The third out of 5 frames that we'll talk about is future orientation. And, that is looking at the bright side of human nature, which puts us, has us wanting to focus on positive aspirations, hopes, and dreams. For some, that might be college. For some, that might be related to a sport or another activity. So one option for speaking broadly and framing a sentence around future orientation is, you are committed to graduating next year, limiting the challenges that could interfere with that goal. Maybe that's why so many of you have chosen to avoid alcohol and other drugs. Another frame that really resonated or has resonated with youth is risk of addiction. And so this is really the threat of dependency, which can also kind of swirl in factors of control versus loss of control. Activating the risk of addiction frame helps us to bring awareness to youth about how substances can harm their body and mind. One of the findings that we found through the needs assessment with Getting Candid is that immediate health consequences were more impactful than longer term. So if it was cancer versus seizures, seizures might have a larger impact just because of proximity to self. I think another thing that we found is, and this relates very heavily to risk of addiction, is that youth had a strong preference for wanting to hear from individuals with lived experience. And so that lived experience of what addiction is like and the risks of addiction was something we found that really resonated. I also will talk about in the next slide a bit more, but we also found that youth today are slightly more interested in mental health consequences than physical health consequences in terms of statement impact. And so, youth care about their mental health and the majority in their physical health as well. But females especially, really do cite the importance of mental health. So if you can wrap mental health into risk of addiction. That's great. And then the last one, really quick, is just adolescents are, heavily motivated and influenced by a myriad of relationships in their lives. And so using those relationships as the backbone to create statements around those and meaning can be very impactful. So thank you so much.
Thank you, Alexandra, for talking us through those frames. You all should be very familiar now with the science behind the frames, why we've selected those, right? You understand the social norms approach. You understand the National Council for Mental Wellbeing's frames that were identified as preferable by youth. You now understand how we've integrated the social norms into those frames and also found the other evidence supporting that. So there is more beyond National Council, beyond social norms that has been identified, and we've included all those references for you in the frames. All right. We're running a little bit behind, so we're going to move to our next speaker very quickly, Clara Gibbons. So Clara Gibbons is with the Frameworks Institute, but she is going to talk us through that next set of frames for a different purpose. And I want to really distinguish this. The purpose of these frames that she's going to discuss is to change social mindsets, okay? To build public support, to rally that support for substance use prevention. She'll go through that, and she will also cover some of the frames to avoid, which were studied by her institution as well. Clara?
Great, thank you so much. So I am going to be talking now about frames for changing mindsets and building public support. And the first thing I will just speak a little bit about is why we want to change mindsets. And the answer to that is right here. It's to build public support. And public support is so important. I don't know how much I need to convince you of this, but you want to engage partners. You want to bring people from the larger community into the work that you're doing. You want to do things like securing funding. You want the public to understand, you want the community to be ready for both your messages and for the work that you're doing. And to do that, you need to change some mindsets. Framework studies how members of the public, both in America and abroad, this research is really going to be focusing on America, how people think and talk about all sorts of different social issues. And there are three mindsets, three ways of thinking and understanding the world that we see come up again and again on everything we study: individualism, fatalism, and us versus them thinking, or otherism. And the way these sort of manifest when it comes to substance use prevention, individualism just really constrains people's understanding of substance use and adolescence. So people think that an adolescent's outcome is really dependent on their grit, or on whether they have good parents, quote unquote, or bad parents, that everything is down to individual choice and there is nothing else. There's no environments, there's no peer groups, there's no broader community. It's just an individual and their choice. And what happens then is that people feel very fatalistic about things. People feel like, okay, well, kids are going to use substances no matter what we do. This is historical. They've always done that. There's really nothing. How can you possibly affect that individual choice point? Or there's so many crises in the world, how can we possibly address another one? And this us versus them thinking, I'll just cover very briefly, this gets into that stigma, right? So there are good kids and there are bad kids. Sometimes this can intersect with really harmful ideas of racism, classism, right? So all of these mindsets really, really hold back getting broader public support and understanding of prevention. So at Frameworks, we're really focused on designing and testing communication strategies to overcome those mindsets and to build public support. Sean spoke about how sometimes your communications can backfire if they're not tested. And so at Frameworks, when we recommend the frames that are in this toolkit, that's because we've tested the heck out of them in a lot of different contexts. So we have spoken to people about the frames. We've seen how they interact with them, how they're thinking and talking about something might change after even just a brief exposure to one of these frames. We've done large survey experiments, giving people a message and comparing their responses to survey questions to someone who didn't receive a message. We do focus groups, we do all sorts of testing, and I would geek out about methods for a long time, but I only have a few minutes. So I just want to talk a little bit about, we have adolescent substance use prevention research available on our website, frameworksinstitute.org. This has a sample size of over 6,000 participants. We have further research on adolescent development and how to communicate about what all adolescents need to thrive. So you can find all of this. I'm not going to be able to go into it. I only have a few minutes left, but you can find it on the website. And of course, a lot of it is in the toolkit. So for us, what we mean when we are recommending a frame, frames that work are going to boost people's knowledge of something. It's going to shift their attitude, so shift those mindsets in more productive directions, and it's going to build support for policies. So in the case of adolescent substance use prevention, these were the sorts of things we were looking for, understanding that substance use is a public health issue, not just an individual one, that healthcare professionals have a role to play, that we can actually do something, and then policies, like changing zoning laws. So these frames that are recommended in the toolkit, they work, we've tested them, and this is the sort of thing that these frames do. And now I only have a few more minutes to talk about all the different frames in the toolkit. So what I really want to focus on is showing what sort of contexts you can use these different frames in, and what that looks like in practice. I'll give you a few real world examples from coalitions we've worked with. So the first strategy that we have here is evoking responsibility. So this is orienting your audience. When you are going out to speak to members of the public, when you are, putting content on your webpage, you're starting with this idea that everyone in our community has a responsibility to promote the well-being of our youth, to support their health, to keep them out of harm's way. So you can use that in your web pages, you can use that in social media, and you can use that just to orient people to a spoken presentation. For example, here, presenting the survey results from a youth risk behavior survey. Highlight solutions, and not just any solutions, but really keep them concrete. We've talked about this already. People don't know that there's anything we can do to prevent substance use. They think that it's inevitable, and that's not true, right? So they need to understand the work that you all are doing, the solutions that are out there that we know work, and you want to keep them concrete, tangible, collective. These are things we can all do, show them how it works. You want to frame towards systems. You don't just want to always be focusing on an individual, right? You want to show a young person in the context where they're actually living, or you want to show environments. You want to show all the people they're interacting with. And one really easy way you can do that is just by thinking strategically about your visuals. So instead of showing, for example, one individual young person, you can show that young person in the context that they're in and show the relationships they have. Frame your data, right? Sometimes this is just what data you pick. This might be social norms. Sometimes it's just making sure that if you are talking about the prevalence of substance use and you want to show that it's a big problem, you also want to include a solution. Focusing on future benefits, not just harm. Crisis fatigue is real. And finally, you can use metaphors, such as the metaphor of boiling over, to talk about risk factors and protective factors. These can be abstract scientific concepts, and actually showing what those concepts look like by using an explanatory metaphor can be really helpful. And you'll see what those look like in the toolkit.
Clara, well done. Thank you for covering all those frames so quickly. We appreciate you. And the toolkit obviously has all of this information in there. So please refer, we're giving you a brief overview. I'm going to hand it over right now to Robert to talk about evaluation of both those conversations as well as your mass communications.
Thank you, Laura, for having me today. I'm going to be talking about some general ways we can think about evaluating our efforts, either in static or dynamic communication. And there are a number of different ways that we can evaluate our efforts, but typically we need to conduct process, impact, and outcome evaluation. Process evaluation questions answer the questions: did we implement our health communication campaign as we planned on doing it? How many people saw our message? How many parents talked to their teen child about alcohol, tobacco, and other drugs? What did they talk about? What frame did they use? We also have to measure what impact are we making. So what impact are we having on either short-term or intermediate changes, let's say in attitudes or perceptions of social norms, or even in believability of messages. And ultimately, we have to examine, did we make a difference? We have to conduct outcome evaluation to determine, did we actually make a difference? Did we achieve our goal? And we refer to this as outcome evaluation. There's a number of ways we can kind of conduct our process evaluation by examining whether or not the conversations we are having are actually working. We can measure reach and exposure. So how often and how many of our messages have our target population had. And we can also measure the impact it's having by looking at, again, knowledge, awareness, attitudes, perceptions, as well as substance use behaviors. So how do we typically determine whether or not our health communication campaign is making a difference? So in order for us to determine whether or not our program or strategy is having an impact, we have to conduct an evaluation in such a way that we're getting objective information. So let's say we want to determine if our program increases parent-teen communication about drugs. We're going to be looking for the impact of this particular program. To do that, we might ask the question, does our campaign cause a change, hopefully an increase? Because as Sean had pointed out, it could also just as likely have a negative effect. Does it cause an increase in parent-child communication about substance use? So the program is what we're doing, and we think that it's going to cause a change in parent-child communication about substance use. That's the whole reason why we're doing this particular program. There's a number of ways that we can conduct both process, impact, and outcome evaluation. And these are outlined for you on page 49 of the toolkit. One type of evaluation information that we could gather is to examine reach. To what extent have our communications reached the intended audience? We can easily get this information by looking at the number and characteristics of people who've seen our communication message and the number of communication materials that we've actually distributed. So how many PSAs have we put up on billboards? How many social media messages? Which messages did we put up on social media? We can also look at the number of times that our media message is mentioned in a retweet or perhaps forwarded to somebody else. And we can also look at the number of posts and tweets and followers that we have on our communication channels. Besides looking at reach, we also need to look at exposure. So how many times have they seen that message? Have they seen it one time, 2 times, 3 times? What's the average number of times that youth have seen that message, and how similar or different are youth to one another in seeing that message? We also need to look at the accuracy of recall. Can they recall the frame or the message that we're trying to get through with that strategy? And it's also very important when we evaluate exposure that we look at what we call the bogus pipeline. We always want to ask in our evaluation, have you seen a fictitious message? That is a message that we would not have delivered. Because if youth are saying, for example, they've seen this message a lot, but I've also seen this fictitious message a lot, which doesn't exist, the data that you're gathering is probably not reliable. We also need to examine fidelity, and this measures the extent to which our program was implemented as we planned. Did we deliver the number of planned activities? How many unplanned activities or how many deviations did we make from our campaign? What were the number and type of adaptations that we made when we went along? What is the number of evidence-based characteristics? So those things that Clara was talking about, how many of those have we included in our message? And then finally, we need to look at, did we make a difference? Were there changes in awareness, knowledge, attitudes towards substances? Were there changes in perceptions of social norms? Were there changes in the number of providers, community citizens, parents that are talking to youth and others about substance use? And ultimately, we have to look at, did our program, did our strategy make a difference in terms of the frequency of substance use? If we can do that, we'll have good information that will tell us how we can change our program. Laura?
Thank you, Robert. All right, there you have it. That's a quick overview of the toolkit, which is 60-something pages long now. However, it's been broken down into very concrete sections to assist you in navigating that toolkit. All right, so with that, we did have a couple questions come in. One was around, are we going to be expanding the toolkit to cover other age ranges? And the quick answer to that is only if we receive technical assistance requests related to this. ADAPT is funded as a TTA provider, and so our role really is to respond to the needs of the HIDA communities that are coming in. So if there are enough TA requests in a particular domain, and I think the example was for 5 to 12, we could then potentially add another section that would specifically address that particular age range or beyond. And so as these TA requests come in, we will do our best then to add the guidance for all of you into that toolkit, and we'll make you aware of any additions to that. There were other questions that we do not have time to address today, but if you would like to send those questions and we have captured them, if you would like to send any others into the ADAPT email, we'll be happy to respond to you about the toolkit and can also connect you with any of the presenters if you would like to speak with them directly. All right, so what I'd like to do now is we're going to round this out in the last 3 minutes. We're going to talk about the call to action. I have the ADAPT team joking with me that I sound like I'm in church or I'm doing a blood drive of some sort trying to issue this call to action. But here's the deal. The point of this particular call to action is not harmful at all, right? Our point is really just to get you to make that next step, that conscious decision to pay attention when you talk about substance use communication, substance use prevention with youth. That's it, period. It's just to really be mindful that there is an evidence base out there, that we've got an existing evidence base. It's not perfect, but it is the best available, and it at least can help you with a more informed approach to your communication with youth. And so as we all know, like even if you just pay $1 for something, right, you are more likely then to appreciate it a little more or give it a little more attention. So similarly, in this case, it's just that next step of just pledging, I'm going to pay attention. I'm going to mind my message. I'm aware now of the material that's out there. Beyond that, beyond the pledge, and Megan is going to go ahead and post that link again in the chat if you need that to the call to action. Beyond that, I want you to know that we are supporting you in this. And I say this very seriously. We've had enough TA requests come in that we designed this entire toolkit with all of our collaborative partners. And it was a big feat. It was a big feat. We see it as a starting point, right? We do see it as a living document, but beyond that, we're going to support you in using it. We will be providing a series of webinars beyond this summit that will help to answer questions for you, that will help you think through evaluation, that will help you understand social norms a little bit better, that will be open into discussion groups, maybe in some ways, right? So that you can tell us and share your experience. One thing I want to mention now is that when you pledge, you'll have a link to a share your experience button. We want to hear from you. What is it like trying on some of these strategies that you find in the toolkit? What's that like? Have you found any that are extremely successful? We've had lots of comments come in today already on the chat about campaigns that apply the social norms approach that they're aware of, that they're very excited, are resonating with them, right? And they're providing the names of those campaigns, and we're tracking all that. So, but we want to hear from you, even if you're a caregiver, if you're public safety, if you're a healthcare provider, right? And I do sound like I'm doing a fun drive, but I'm not. This costs nothing at all. It really is. Can we mine the message together as a community for the most impact that we can achieve across our nation in preventing substance use in youth? That's it. So we invite you to click on that link, pledge, try to do those 4 steps. Just try one social norm, just try it on and share it with one person. And together, then we can take the next step to an evidence-informed approach using the best available evidence. All right, so with that, I'm going to wrap it up with a bow. We're going to move on to our next session, which is an application session. So we've invited representatives from these roles to talk about how they are going to be applying the toolkit and give you more ideas. I'll see you over there.
Magnetic, got a pull so strong that you can't